Good morning. My name is Greg Bloom, and I'm a partner director of Garfunkel Wild and the chairperson of Garfunkel Wild's corporate department. I want to thank you all for joining us today for our 8th annual ASC and Healthcare Management Symposium and the second virtual version of the symposium. This is going to be the local tri-state portion of our annual State of the Union segment, and we're happy to have the leaders from each of our 3 tri-state ambulatory surgery center associations who will give us their perspectives on the current state of the industry and hot topics from their respective states, followed by some questions for our leaders. I'm going to keep my introductions brief today, as most of you are familiar with all of our leaders from past years. First up, we have John Van Valkenburg, the president of the New York State Association of Ambulatory Surgery Centers. The New York State Association represents over 130 ASCs and provides educational programs promoting safety and efficiency in ambulatory surgery and advocates for legislation which impacts care in New York. After John, we welcome back Lisa Winkler, who will provide us with the Connecticut update. Lisa has over 20 years of experience in many aspects of local, state, and federal government relations. She spearheaded the development of the Connecticut Association of Ambulatory Surgery Centers in 2005 and remains the association's executive director. Following Lisa, we welcome back Jeff Shanton, president of the New Jersey Association of Ambulatory Surgery Centers. In addition to serving the association, Jeff is also actively involved in many other advocacy and legislative groups on behalf of New Jersey ASCs. Thanks again for joining us today. And now I'll turn it over to John Van Valkenburg for the New York update.
Sorry, thank you, Greg. Thank you for the introduction. Like Greg said, this is John Van Valkenburg. I'm president of the New York State Association of Ambulatory Surgery Centers, and I'm happy to be here today with you. First off, just kind of a New York State update. I'm sure it's no surprise, but it's been another hectic year. Obviously, with the COVID-19 pandemic, continues to be front and center in our lives, obviously, but also certainly in the business of running our ASCs. Some major developments for New York that affect ASCs so far this year. On May 12th, the New York State Department of Health waived the testing requirement for fully vaccinated or recently recovered patients. That same guidance update also added rapid antigen testing as an allowable test for the first time. Unlike some of our neighbor states prior to that guidance, PCR testing was the only testing allowed for preoperative. Both of these updates were very positive because they created additional pathways to achieve patient eligibility before their procedure or surgery. That same guidance also strongly encouraged testing of all patients, including those fully vaccinated, in regions with a positivity rate of greater than 2%. Now, it's interesting, it's important to note that at the time that guidance was released in May, the positivity rate was statewide was about 1% and falling. So it looked like everything was going in a good direction, and we weren't really too worried about maybe having to get back into testing. It seemed like maybe we were getting away from testing altogether. Then in mid-July, with the emergence of the Delta variant, the rates started to increase, and by the end of July, regional positivity rates exceeded 2% in all regions of the state. Due to that strong encouragement in the May guidance and the fact that breakthrough infections among vaccinated were not uncommon, many ASCs resumed testing of all patients, including the unvaccinated. The DOH never made this a specific requirement, so they never actually updated their guidance to mandate it. But I know a lot of facilities started doing that based on that strong recommendation, and also just trying to maintain what they were doing. Also, speaking of vaccines, on August 18th, the Department of Health delivered a summary order requiring staff in all hospitals and nursing homes in New York State to be vaccinated by September 27th. In that initial order from the Department of Health, ASCs were not included. So at the time, we thought maybe we weren't going to be dragged into that or included in that mandate. However, we thought that it probably wouldn't stay that way. So sure enough, on August 26th, the Public Health and Health Planning Council adopted an emergency regulation requiring all staff, paid and unpaid, in hospitals, nursing homes, ASCs, licensed clinics, home care agencies, dialysis centers, basically all licensed facilities in the state to be vaccinated. The date of September 27th remained intact for hospitals and nursing homes, and the date was October 7th for the deadline for vaccination for all the other covered entities. In that regulation, medical exemptions were allowed, but as certainly if you're in New York, you probably know because it's been on the news, no religious exemptions were allowed at that time. And the result of that was an ongoing court case, or actually several ongoing court cases now regarding the lack of the religious exemption. And because there's no religious, this is difficult for ASCs and other facilities because there's no religious exemption in the regulation, there's also no guidance on how to handle religious exemptions. So ASCs really need to speak with healthcare or labor law attorneys to determine how to handle claims of religious exemptions at this time until at such point, I don't know, maybe with the progression of the court cases, you know, we end up, the Department of Health ends up putting forth some type of guidance with regard to that. But as of now, there really is no guidance. On another topic, or off the topic of COVID, workers' comp fee schedule. So this was a good development for us in New York State. On March 31st, the New York State Workers' Comp Board adopted an emergency regulation that has since been made permanent. And this regulation increases the facility fee for ambulatory surgery services for 29 musculoskeletal CPT codes. It included codes for total joint replacement, some fracture care, as well as ACL reconstruction and arthroscopic rotator cuff repair. To be honest with you, this came as a little bit of a surprise to us. We didn't really see it coming. It was certainly welcome, but you know, again, it kind of came out of nowhere. So at that time, when we heard about it, we reached out to the Workers' Comp Board to discuss the regulation. The Workers' Comp Board explained to us that the purpose was to help encourage some of these procedures to be done on an outpatient basis. They were mostly being done inpatient, often due to insufficient reimbursement relative to cost and not for clinical reasons. And what they had discovered, what they found out, that as you know, due to the pandemic around the new year in 2021, a lot of workers' comp beneficiaries were unable to access these services because they weren't being done on an outpatient basis, because a lot of the hospitals had really limited the inpatient care they were providing to try and preserve bed space and everything like that. So again, you know, the motivation was great. We really liked, you know, what they were doing there and the direction they were headed in. So we applauded the move, but explained that the increases for some of these procedures, particularly the total joints, although it was a large increase from where we were at before, they were not sufficient to achieve their stated goal of getting clinically appropriate cases to the outpatient setting. We also suggested to them that they add more procedures beside just the 29 they selected. We suggested that they also include some spine CPTs and some other procedures that you know, we knew as particularly the orthopedic ASCs in the state, you know, we were not able to serve these patients because of issues with the reimbursement. So we are currently in discussions with them to try and help enact these suggested changes. Just kind of a heads up for New York State ASCs, cost reports. The 2020 cost report software is late again this year, and it has still not been released. When it is finally released, and usually we don't know when that's going to be, ASCs will have 60 days to submit the cost reports. So make sure you kind of keep an eye out for that in the midst of everything else that's going on, but that's going to be an important thing. And then just kind of an update on our state association. You know, through the past year, the New York State Association of Ambulatory Surgery Centers has continued to inform and help our members navigate the ongoing pandemic and guideline changes. We've continued to grow our membership as the number of ASCs in New York State has increased, now to up to about 165 or so licensed ambulatory surgery centers in the state. We were successful in getting a resolution passed in the New York State Senate and Assembly that recognized August 2021 as Ambulatory Surgery Center Month in New York State. So that was something we were really proud of. We had some legislative visits tied in with that to kick off the month, and we saw that as a big success for the association. Another big success on September 29th and 30th, we held our first in-person conference in 2 years. That was held in Tarrytown, New York. We had a great turnout. It was great to see everybody again. If you were there, then it was great to see you. We have scheduled and already started planning our spring 2022 conference, which will be held May 10th and 11th at the Saratoga Hilton in Saratoga Springs City Center in Saratoga Springs, New York. So really excited about that as well. If you represent an ASC in New York, we hope you can attend. If you have any questions about our spring conference or about membership in the New York State Association of Ambulatory Surgery Centers, please email us at info@nysaasc.org. And regardless of what state you're in, if you are not a member of your state association, please join. It is extremely important to promote the interests of ASCs and to support ASCs, throughout New York State for us, but also throughout the tri-state area. So, thank you for your time today, and thank you, Greg.
And thank you very much, John. And I reiterate that all your associations do great work for your members. So I echo that to everyone. Join your association. And thanks again for joining us, John. And now I'll turn it over to Lisa Winkler for the Connecticut update. Lisa, you're on mute.
Okay, I'll unmute. And
There you go. All right.
That was a little tricky there. Okay. Perfect. First, I want to say thank you. And full disclosure, I think the 20 years of experience has now changed to 30 years of experience. So it's shocking to say, but my business partner was like, should we just say decades? And I don't know which is worse. Anyway.
Next year, I'll confirm with you as to how you want it.
Yeah, I guess we've been doing this for a long time. I don't
know.
We can just say 20 years experience. That's funny. Well, thanks so much. It's always such a great meeting, and we really appreciate the opportunity to talk about what has been going on here in Connecticut. So just by way of background, I always like to give a little bit of background information about the association. So we formed the Connecticut Surgery Center Association in 2005. Membership includes all of the state's freestanding ambulatory surgery centers. You may remember that Connecticut required physician offices that were providing moderate to deep sedation to become licensed as surgery centers. And in all honesty, that's where we've seen a lot of growth in the market today, as you have plastic surgery offices converting into multi-specialty facilities. Connecticut also requires surgery centers, hospitals, and nursing homes to belong to a patient safety organization. And our association was able to start its own patient safety organization and really looks at a variety of safety issues, hand hygiene, and really use the patient safety organization throughout the pandemic as a way of educating our members and providing educational resources and materials, signage, and other things that we really could use to address the patient safety needs of our surgery centers throughout the pandemic. We really have had a history of success and a strong unified voice for our surgery centers. Throughout the pandemic, we've really tried to maintain a line of communication with the state to address different needs. We were certainly part of surge planning at the very beginning of the COVID-19 situation. We shared staff, anesthesia machines, and PPE with hospitals and other providers, nursing homes. We were getting calls when elective cases were halted in our state. We provided an inventory of available resources that we could share with the department so that we could really look at, again, the surge planning needs. And we really tried to facilitate collaboration between the hospitals, the Department of Public Health, the health systems, so that we could really look at the individual community needs and really try to avoid halting elective cases going forward. Of course, we were involved with the state in facilitating the ability to resume cases as well. For many years, you have heard me speak about the surgery center tax. It's like the bane of our existence. And that was, again, a big issue for us in the 2021 legislative session. It was a remote session, so we were not able to be in the building. And much of what we did was through Zoom and other meetings. Many of you will remember that the surgery center tax was initially passed in 2015 without the benefit of a public hearing. It was part of the state's largest tax increase. Unfortunately, it was the highest in the nation, a 6% tax on gross receipts. Also, unfortunately, ongoing relief efforts were hampered by an early strategy that alerted CMS to impermissibility concerns. One of our key champions in the legislature put in a $1 million exemption from the tax, which triggered some impermissibility issues with CMS. Since the tax passed, we were in regular communication with legislators and legislative champions, meeting, doing Hill visits. I'm sure you'll remember through all of my presentations, living through this. And obviously facility visits as well, which was helpful to really demonstrate the value proposition of surgery centers in Connecticut. We did achieve incremental relief in previous sessions. We were able to exempt Medicaid and Medicare, and we were able to fight off efforts by the administration to remove the $1 million exemption, which was, about a $3 million hit to surgery centers. In the 2021 legislative session, again, remote, the administration proposed eliminating the $1 million exemption again with no equivalent rate reduction. Our champion, Senator John Fonfara, the chair of the Finance Committee, really had been pushing for relief. He totally sees the value proposition of surgery centers and sees the potential benefit for cost savings, both on the state employee side and on the Medicaid side. So his package proposed a reduction in the tax rate, maintained the Medicaid and Medicare exemption, as well as the $1 million exemption, and created new deductions. So basically 50% of your Medicaid revenue would be a straight deduction from the tax, and then 25% of state employee revenue would have been a straight deduction from the tax. So in some situations, you would have had centers who actually could have received money back as an incentive for treating these populations. And also his proposal limited the tax to facility services, changing it from a gross receipts tax. After a lot of back and forth, a lot of push from the governor's office, we were able to pass legislation that will take effect July 1st, 2023, that reduces that 6% tax rate to 3% and limits the tax to facility services from gross receipts. They did eliminate the $1 million exemption. DSS has pushed on that issue for so long because of concerns with CMS and the impermissibility issues, which could potentially jeopardize the federal matching funds that the state receives to fund Medicaid. So it was significant tax relief, close to $9 million that we were able to achieve. And we're optimistic that in the coming session, Senator Fonfara will again advocate for further relief as part of that package. I think he feels like once we've sort of gotten out from under the impermissibility concerns, there's a lot more opportunity there to provide additional relief. Connecticut still is in the public health emergency, and currently another issue that we've been very focused on is licensure surveys through the Department of Public Health. And so those licensure surveys, DPH was so involved in other issues throughout the pandemic and spearheading a lot of the efforts at the state level. So all of the licensure surveys were put on hold in the state. The public health emergency remains in effect now until February 2022. I think it's February 15th. The legislature gave the governor public health emergency authority until that time. And so surgery center licenses will remain in effect until 6 months after the public health emergency. I think that's an important piece for facilities to understand. I know we've gotten a lot of questions about that. DPH is trying to undertake a very aggressive schedule. They had a lot to do with the hospitals and nursing homes and are looking at, really ramping up surgery center visits over the next couple of months. They are super short-staffed. A lot of people have left the agency following the pandemic. I'm sure many of our states are seeing that currently. So that has certainly been hampering their efforts to visit centers. But it is something that is important for centers to understand, that those licenses remain in effect until 6 months after that February date. And as John said, it is so important for surgery centers to tell their story and to let legislators know what their value proposition is. So I always like to talk about the PAC because of our involvement with the national PAC. That's so important that we have legislators in the mix who understand what we do, and it's important that we support them. It's important that we have a strong, unified voice in this process and that people understand how COVID also impacted surgery centers. I think hosting a visit, some of the things that John talked about, that's so important so that people really understand what it is that we do and, you know, the terrific care that we provide. So I think I'll leave it there.
Thank you, Lisa, as always.
Okay.
Great information for the people in Connecticut and everywhere, and we appreciate you coming back. And now for the New Jersey update, Jeff Shanton, thanks so much.
Thanks, Greg. Appreciate the opportunity. Been doing this for a lot of years. Yep, good to see you, John. Good to see you, Lisa. Again, we're the old pros. We've been on this for I don't know how many years together. I'm going to start off with the join your state organization. I'm not going to leave it till the end. It's more important to join your state organization. Bill Prentice won't like this than even national and ASCA. State is where your regulation, rules, everything else like that, 99% of how you operate your surgical center come from. I'm not saying you shouldn't, but you should think state first, national second. Too many centers think they know everything, and they sure as heck don't. Plus, they do not have the resources of legal, government affairs, and everything else like that that the state organization does, which is why you need to be a member. We've been in existence here in New Jersey for, I think, 32 or 33 years. And we have seen through the pandemic unprecedented growth, which is not what I thought. We've gotten a lot of centers that have joined us, but more importantly, we also have vendor members that pay dues and are part of our organization. And we have that more than I thought we would lose them because of not being able to have in-person meetings, but we didn't. We grew probably by about a dozen. And in fact, just like John was saying, our good news is on the 27th of October, we are going to have our first live quarterly membership meeting in probably about 2 years. So, you know, that's a very, 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 very good thing for us. We held our own meetings, our annual event, our annual ASC conference, and all of our quarterly meetings and everything virtually. We had purchased and designed our own virtual platform, so that's what we've been using over the years, over this past year, and actually through last year. We have not had any real big issues as far as the state goes or Department of Health. Obviously, the EOs and the EDs that come out. But it's an election year here in New Jersey. We have a governor, the entire Senate, and the entire Assembly who is up for election. So that's a good thing. Even though I know a lot of them are dying to come down on us and everybody else with taxes and draconian rules and regulations, it's not going to happen because it's an election year. So we've been kind of shielded from that. That said, you know, there were still several things that we're doing and we're working on here. A couple years ago, we had actually probably about 4 or 5 years ago, we had a one-room law passed where registered surgical practices, one-rooms had to be licensed as ASCs. We actually wrote that law and put it into effect, got it passed, but we're still waiting. There's still probably about 40 or 50 one-rooms that are waiting for inspection surveys to come out from Department of Health. So we're hoping we can speed that up. We're also still in the throes of our own out-of-network transparency law, kind of like the federal one, surprise medical billing. Ours we've had for a while, and quite honestly, the feds, the New Jersey delegation took a bunch of stuff out of our state one to put it into the federal one, including ballpark arbitration. That really doesn't affect ASCs. The arbitration part, that's mostly hospitals, emergency rooms, things like that. But what the state does do is they do track the results of those arbitrations. And for last year, providers actually won 65% of the arbitration cases. So that's a very good thing. It's not like, this is stacked against healthcare, quite the contrary. We unfortunately are still waiting for final rules from Department of Health, Department of Banking and Insurance, and Board of Medical Examiners on exactly the forms to use and notification and things like that. Department of Health did give us some interim things, so centers have been using that. We're also arguing with the department because the department is taking the stance, the federal stance, that you have to post standard charges on your website. Well, we said, what if you don't have a website? And they said, well, you have to have a website. I said, really? Show me that. Try to get that through. Show me that. No, it doesn't work that way. It's their interpretation, by the way. So that's another one of the legal things that we're giving lots of money to attorneys like Greg and others to argue for us. We also had another law that came through this year, doctor transparency, not to be confused with the out-of-network transparency law. What this was a pet law direct from the governor. During the days of the pandemic, when there was no ability to have commentary in person on legislation, people were apparently making themselves doctors that were not doctors and commenting to the Assembly and the Senate and the governor. Well, that was found out. So we now have a law that says you now have to have on your lab coat or whatever you have specific information, not just your name or anything like that. You have to have your professional degree. You have to have everything. You also have to have a listing in your waiting room of all the doctors and their professional credentials that show up at your surgical center. So, it really is a good thing. And quite honestly, at least here in New Jersey, anybody that walked into an ASC had to have identification on anyway. It doesn't say you have to be picture. So, that's something. Hospitals, have to have picture. Doctors, ASCs don't. Those are about really the only three things that are really out there for us. We're now interpreting. We got a directive interpretation from the governor's executive order from August, which was our vaccine mandate. As I said, as I was talking to everybody beforehand, we're lucky here in New Jersey that there has not been one lawsuit filed under our vaccination mandate. Now, that's because it's an election year. It was watered down to not be just vaccine, it's vaccinate or test. So that kind of damped down the vitriolic, arguments out there from some people, though I would dare to say I don't understand how, you have to pay and get tested twice a week is anything easy for somebody, but apparently I guess they choose that over being vaccinated. The Department of Health just put out an executive directive interpreting some of the executive order. We had asked them to do that. But even before that, we had gone to the department and asked questions and put an FAQ out for all of our members. So nothing should be really earth-shattering in what you have to do as far as that goes. We had our annual event virtually this past year in May, which was very, very, very well attended. We also did our annual infection control conference in March. We do that in conjunction with the Department of Health. And what that does is here in New Jersey, you have to have an in-house infection control person who has training. You also have to have, if you don't have that infection control person trained, pretty much every single surgical center, you have to have an outside infection control person come in as well. So what our infection control seminar does is it gives the continuing training for your in-house person. And after they take that the course actually were on the website listening to it. We, by the way, had software that can track that you actually viewed every single thing. You didn't just log on and go to sleep. They then got a certificate that they could put in, you could put in your files that said you completed the course. So you have some continuing training. We've done that we've done that twice with the Department of Health. We do it every second year, every 2 years with them. So that's kind of an interesting thing that we do. We've also continued with our robust program of webinars. In fact, we just put one on 2 weeks ago about billing, collecting, and things like that. And the participants were all vendor members of the organization. That's how we utilize our vendor members. So we did not have anybody from the outside, billing companies or anything like that. Everybody that was on the webinar and presenting were actual vendor members of NJASC. And we are next week going to be putting on a webinar about the executive directive and about the executive order. We just put it out yesterday, and I think when I looked this morning, there's already 150 people registered. So pretty much essentially what we put out there, people respond to and join. So that's about it for me. Just wanted to say thank you again, Greg, and it was nice meeting up with everybody. And if anybody ever needs anything as far as New Jersey goes, just Google us on the website. Send us an email, call me, whatever you want to do. I'm here all the time. Glad to help anybody.
Great. Thank you so much, Jeff. And yes, we appreciate you coming back for many, many years, and everyone, John and Lisa. So thanks for the updates. We did have a couple of questions for you guys, for any of you who can stay. I know, Jeff, you have a short window here if you need to run, but we'd love to have you stay for just a few more minutes if you can. So we're all seeing in the news, and many industries and businesses are experiencing staffing shortages and supply chain issues. Do you see that with your ASCs? And if so, what are you seeing out there?
Yeah, Greg. I'll jump in on that. Absolutely. I know a lot of ASCs have been seeing it. I know it's something that's been compounded in New York State by the vaccine mandate. I know there's, at my facility, but also a lot of the facilities I've talked to throughout the state has lost members of their staff. Usually not in high numbers, but enough where, we were already staffed very thin. We've struggled, throughout the pandemic, to maintain staffing levels and to attract new, particularly clinical staff. We're constantly battling with the hospital. There's fewer nurses than there are nurse positions. I know it's certainly in Syracuse and really throughout the state. So, even a small percentage of that workforce kind of exiting the pool, compounded an already existing problem that I know, for hospitals, our local hospitals have been shutting down. They've shut down their ORs and everything like that. I think ASCs, as they usually are able to pivot and are quite nimble, have been able to kind of deal with it, but it continues to be very difficult. And then to the supply chain issues, the same thing. And I think I know in my facility, we're starting to see it. We've kind of, there's been back orders and things going on for a while, but it seems to be escalating. Not just the actual availability of supplies, but the actual getting them, delivery of it. And we're already getting heads up from a lot of our vendors saying, hey, we're expecting all these delivery delays just from, how they're able to deliver the supplies, whether it be FedEx or UPS or whatever. And now with the holidays coming and everybody buying their stuff online, that's more deliveries. So I think it's absolutely going to affect us. It's already affecting us, and we're just going to have to do what we always do. And that's just, stay nimble and really just do what we can.
Right. Okay. Yes. And aside from FedEx and all that, the trucker shortages, if you have any family members who are truckers, get them out there working. How about you, Lisa? Anything?
Yeah, I think throughout the pandemic, obviously, there's been concerns about resources, and in talking to our centers, certainly there are some items that are on allocation. I don't think it has hit us quite as bad as yet in terms of some of the materials and resources. I will say we've certainly polled our members in terms of the vaccination requirements, and we were pleased that we had such a high number of centers with staff that complied with getting the vaccine. You know, certainly the federal provisions and requiring everybody to get vaccinated. Connecticut itself, the state is actually in the process of letting state employees go who have not been vaccinated. I think we're up to like 48 employees have been let go as a result of not complying with the vaccine mandate or the testing component. So, you know, there's always a concern once the requirements went into place that you'd see some people pivot to other facilities. We certainly don't want to lose staff. I think, as John said, you know, we're nimble organizations. We have terrific staff, and we've always been a good landing place for really some terrific nurses. So it's certainly a concern. We're going to keep our eyes open. I think the delivery concerns with regard to, you know, FedEx and others are certainly worrisome. And, you know, I think we'll hopefully be able to make it through, but certainly concerned about where we go.
Okay, thank you. Jeff, anything different in
Yeah,
Jersey?
I'm going to pivot a little and talk a little bit differently about this. Because, you know, I have centers that before things were even put out were crying wolf about this happening. And I said, explain to me why. Our mandate is for all state licensed healthcare facilities, licensed with Department of Health. If you're a nurse, where are you going to go? It's not like you're going to walk out the door and go down to the facility next door and say, okay, I'm going to work here because I don't have to get tested. So unless you're going to change your life and flip burgers at Wendy's, you're a nurse and you're going to do this no matter where you are. And when the federal mandate, you know, comes in, it's going to be even, you know, more. So I am not sure that I agree with all of that. I think that's a supposition out there, and I think it's overblown. And I think at the end of the day, you know, I'm not so sure too. Look, I know there are people that are strongly anti-vax and have strong personal or religious beliefs. Yes, you are going to have some of them. But at the end of the day, I just don't believe it's going to be there. Like my old center upstairs, which is a very big center, runs a lot of, you know, has a lot of people up there. There's one person who is not vaccinated that's testing, and they've lost nobody. So that's just my opinion.
I guess time will tell, and hopefully it doesn't hit too
You
bad.
know,
Hopefully you're right.
I just wanted to point out one thing
Go
too.
ahead.
A lot of what we've seen on the hesitancy side has been focused around fertility issues. We've tried to do a lot of educational programming through our patient safety organization to really address some of those concerns that we've seen across maybe the nursing staff. People who are thinking about getting pregnant, there is a lot of misinformation out there on Facebook. And I think you've seen some information come out from the CDC. If you're, you know, you should actually get vaccinated.
Right.
And so we've really been trying to address some of those concerns. I think there certainly is some element of hesitancy across, you know, healthcare providers, but we've really been trying to address some of those. And so far, we've been pretty pleased about the numbers that we've seen get vaccinated. So.
Yeah, and in fact, our executive order for ours, part of the instruction in it is you as a covered employer, a covered entity, you have to provide education as part of your policy to all of your staff. You have to explain to them the benefits of vaccination. You have to do all of that kind of stuff. So it's not just like you're bringing somebody and saying, you got to get vaccinated or you got to test. You have to have a policy that covers it, and you have to prove that you have talked to your staff individually and explain to them the merits and the benefits of getting vaccinated.
Right. That education is key. So so keep it up and keep getting that education out to your members and staffs. I think we only have a very brief time. I was hoping to get to a bunch of questions, but I guess staying on, and hopefully this will be the last COVID question, and next year we won't even be talking about COVID. And at some point, COVID will be behind us. If each of you can give us, you know, one or two quick changes that arose during this pandemic that you think are here to stay, and let us know if you think those are good things or bad, that would be great. And try and keep it brief. We're running out of time. Jeff, you want to start since you're right there?
I would originally a week or so ago have said telehealth. But it looks like we're having a battle here in New Jersey with our telehealth legislation. And rightly so, as usual, you know, the legislature has a habit of writing horrible legislation, and they don't think of many things, and that's part of it. We're hearing that it's going to be conditionally vetoed by the governor. So we're going to go back with this and, you know, find out what's going on. One of the biggest issues with it is, you know, they're afraid of fraud, because you see that every day and in the newspapers. I would have originally said that, but that's a moot point now.
All right, that's a good one, actually. John, in New York?
Yeah, thank you. I mean, I think this is certainly not limited to New York, and it's been something that's been going on for a while. But the migration of cases out of the hospitals into ASCs, obviously, like I said, that's been going on for a while. We have seen in New York, and I'm sure it's the trend everywhere, a real acceleration since COVID. And I think that's multi-pronged, but part of it is I think patients have been a little bit scared of the hospital through this, and they've opted, and they've really strongly preferred that opportunity. But not just that, what I've already seen is some doctors, you know, in some of those higher acute, you know, some of the spine and total joint cases, there was a little bit of a hurdle. There was a comfort that they just had to get past, and all of a sudden, when their ability to do these cases inpatient no longer existed because of restrictions the hospitals were putting on, that kind of forced their hand a little bit to test the water more than maybe they were willing to do before. And they did that, and they had great outcomes and great success. And I don't see them going back. I mean, we have some surgeons that you know, I was kind of trying to push, and they always said, well, you know, I want 23-hour and things like that. But, you know, it's they, like I said, they kind of had to jump in the pool because it was either that or do nothing. And the water feels good. So I think that's here to stay. The one other thing I would say is, and this isn't, you know, something that came up. I know in New York State, this whole is galvanized the ASCs and the members of our organization, and has really brought us closer together. It really improved our strength in the also the participation among ASCs and members in New York State. And again, I certainly hope, and I think that's something that'll be here to stay as well.
Great, thanks. And then I guess mostly not great, but it sounds like there are some good things coming out of COVID. Lisa, anything in Connecticut?
You know, certainly a lot of those points. I think also just in terms of how we're approaching care, in terms of spacing patients, the heightened focus on infection control practices, hand washing. We're doing a lot on the educational side for patients there as well. I think there's a renewed focus. It's something that we've always been, you know, very focused on. But I think, you know, we talk about those barn burner days in some of our centers. And I think that, you know, the delivery of care in terms of timing has changed a little bit, and we're still seeing that. So it'll be interesting to see how, you know, that continues to unfold as we go forward.
Okay. Those are all very positive things to come out of COVID. So it's not all bad. So I appreciate you guys, all the information and the looking at the positive side and joining us here. And thanks for joining us. And we'll hopefully see you all again next year. Thanks again.
Thank you, Greg.
Thank you so much.
All right.
Thanks, Greg.
Bye-bye.
Good to see everybody. Bye-bye.